I'm gonna make it happen. You know what I mean? Yeah, I'm gonna make it happen. Nothing like fireworks in the morning. 7:29. Let's go to the K-Wave News Zoom room where it is looking very sunny in Tamuning at the Guam Behavioral Health and Wellness Center. The director, Therese Arriola. Good morning, Therese.
Good morning. Good morning, everyone. Buenas noches.
Wow, like I said, it's looking very sunny over there at GBHWC.
It's sunny here, but in Barragata, it's raining.
It's raining here in Harmon, too.
So,
Yeah.
All right, so we'll just get right into it. We had got a tip. I know I talked to you about it yesterday. About some positives at one of the cottage homes that Guam Behavioral Health and Wellness Center overseas. So if you could, Therese, give us some info on that. And I'm trying to find it on my phone, the tip that we had got. So I'll go ahead and tell you what we have after you tell us what you have.
Right. So it's
well, yeah, go ahead, Sabrina.
no, what we had got was an individual and her had tested positive Friday. The individual and her boyfriend had tested positive. They both had been sick since last weekend. Friday, she got word that her coworker tested positive, which prompted her to get tested. Most of her coworkers are positive, including one that is pregnant, which is 8 so far, and 3 clients they tend to at the cottage home who are all under 17. 2 of her coworkers are on lockdown in cottage with the 3 clients till October 13th.
So who's my reporter?
What do you mean?
Who's sharing you that information? Her and her boyfriend? I'm not sure who you're talking about.
Okay, well,
Right?
regardless,
That's
it's an
the first sentence
employee.
is her and her boyfriend got sick last weekend.
Friday,
Is that
tested
what you-
positive Friday.
She is my. Which one is my staff? Both of them?
The female.
The female. So, first of all, Chris, thank you for calling me yesterday. And, I'm always willing to talk to KOAM. I've never said no.
Thank you.
So, yeah, no problem. It's, what threw me off yesterday in your conversation was you kept saying cottage home.
Yeah.
So, when I think cottage home, I think of the Talafofo cottage home that the Lieutenant Governor and I are working on trying to get transferred to Guam Behavioral Health.
Right.
So it kind of threw me off when you said cottage home.
Not
So
bad.
we do have homes, for the record, at Guam Behavioral Health that houses individuals who do not have homes or need special care, or they have either as a child or children under 18, serious emotional disturbance, or adults, we call it serious mental illness. So we have several homes throughout the island, and we do have one home for children. And Friday, we were informed, it wasn't last weekend, and it wasn't a female. It was Wednesday. Apparently, one of the staff, male staff, called out sick because he wasn't feeling well. And of course, the protocol is there are no MARTA working. You cannot be coming into work if you have any sign of the flu or so he did that, and he, of course, he went to get checked when he got checked and swabbed. They gave him a test. He was positive. He informed us Friday, and because he works in a home where we care for our clients, I immediately coordinated, and thank you to Public Health and for all the work that they do. I immediately coordinated with Dr. Kaneshiro and the nurses, the good nurses up there at Public Health Northern, to come into the home and do an entire testing, if you will. And we found out late or early Friday evening that the clients are positive, and most of the staff I had to coordinate for a Saturday morning, early morning testing. Not sure who the 8th person is, but we do have 7 positives, staff positives. But the very good news is, and I'm hoping it stays this way, of course, is that everyone that we are in contact with are asymptomatic, which is threw everybody off. Nobody was sick except this one male. And it's unfortunate because it's that one male on Wednesday that was having symptoms that caused him to get the test, that caused me to set the testing for the entire staff and house. But unfortunately, he's just symptomatic. There are others who are asymptomatic, or everyone else is asymptomatic and doing very well, by the way. And so you don't know who brought it in. Was it the symptomatic person or the asymptomatic person? So the bottom line is everyone is doing well. The clients are doing well. They're bored because they're bored, and we're trying to get them to stay in their rooms and isolate. But in reality, the whole house is in isolation. And so we wish our staff well. They're all in quarantine, and we will be expecting them for an all clear testing before they come in. And so, the good news is that everybody is well.
Yeah.
So you said 7 positive staff. How many? You said 7 positive staff. How many clients?
7 positives, 5 negatives.
And how many of those
Right.
are clients and how many are staff?
And 3. No, that's 7 positive staff, 5 negative staff, and 3 positive clients. But they're all doing well and quarantining, isolating.
Right.
The positives need to isolate, and the negatives need to quarantine.
What are the age ranges for the positive clients?
16 and 9. 2 16-year-olds and 1 9-year-old.
And then, so Therese, what's the current status of operations at that particular facility?
Because they're asymptomatic, we continue to serve. We continue to help them with their homework and life skills and everything else on the daily basis. The home itself doesn't seem like anything is going on because everyone is well. I had to lock the home down because they're positive.
Right.
And I had to send everybody home to either isolate if they're positive or quarantine if they're negative. And so the operation of the house is ongoing. Actually, we have, the nurses at public health check on our clients and check on the whole home. And then I have sent our Guam Behavioral Health nurses to check on them daily. So I get a 2 times a day report on how the house is doing. And as late as last night's report is everyone's doing well, still asymptomatic. And it was like day 3 yesterday? No, day 4. So they're doing well. And so the house is operational. The kids are still doing what they do daily. They don't, other than the fact that being told that they're positive, they don't feel any different.
So just to clarify, you have positive clients secured in a facility being monitored by positive staff.
Well, the best thing for these clients, because they're young, they are children under the age of 18 who are clearly with Guam Behavioral Health for obvious reasons, an emotional disturbance. The best rule of thumb was to keep them in the house so that there is no need for more adjustments in their lives. And so I made a decision Friday to lock the house down, to consider it a mini isolation, if you will, a mini isolation house for the sake of the clients, so that they don't have to they don't need to be moved to Bayview. They don't need to be moved to the hospital. They're asymptomatic. I have my nurses checking on them twice a day. Public health is checking on them twice a day. They have hourly, it's called a monitoring sheet for each one of them that they monitor. Are they feeling any symptoms? Is there any fever spikes or any other symptoms, body aches, of those, whatever all the major symptoms. In other words, do you feel anything different today? And so monitoring sheets are happening. Our nurses at Guam Behavioral Health are checking the house to make sure that everybody's okay. Actually, the house probably gets more calls today than ever because you have every manager, senior management, nurses unit calling, uh, and public health on top of that calling.
Right.
So there's a lot of people checking on them. The house is really self-contained. You know, they get food.
Yeah.
You know, everything's normal,
Yeah.
with the exception of them being told they're positive.
So how many,
That's
are you able to tell us how many staff are isolating at the facility and how many clients? So it's 3 clients. And how many staff?
right. And two are with the 2 are in the home because, as you know, there are our responsibility, and so we cannot leave the kids alone.
Yeah.
And so we have 2 staff with them all the time. And so, good. Yes, go ahead.
Oh, no. So there's 2 staff, 3 clients.
2 staff, 3. So there's 5 people in an isolation
Okay.
home right now.
What, Therese, what would the
And they're all asymptomatic and doing well.
nice. What would the protocol be if one of those staff took a turn for the worse? You know, they started manifesting symptoms, and you had to then maybe move them out of that facility.
Right. Well, the protocol would be that they would, because they're symptomatic, we would want to make sure that they are seen by a doctor.
Right.
And so the protocol would for them to go to their doctor or 911. With regards to the clients, the minute they feel sick, the protocol is call 911 and take them to the hospital.
Okay.
Our greatest concern and is, as you know, and every day, it's very, very disheartening to hear how there's so many deaths. And it's clear that there is no rhyme or reason or no age preference for this disease. And so it doesn't matter if it's a mild symptom that flourishes, we're going to take them to 911, to the hospital, and make sure that they're checked out. But for today, and maybe because of many, many prayers, they are asymptomatic. And as I mentioned before, other than being told that they have the virus, nothing has changed in the house, and I thank God for that.
How did you take the news, though, Therese? That because this is a big, it's a big
very
piece
heavy.
of info, right?
It's very heavy for a director because they are my responsibility. And so I cannot even begin to stress enough to the people of Guam how contagious it is. Because one thing's for sure, and to be clear off the bat, is that Guam Behavioral Health has done everything in its power to prepare our staff for the protocols. I mean, I don't know where it went wrong. And I can see how nobody thinks, we don't even know who received the virus, really. Because when you're asymptomatic, you cannot, do you blame the symptomatic person? Of course not. Because they just happen to be symptomatic. But who's to say the asymptomatic person did bring it in? Right? But Guam Behavioral Health has done everything, has provided, there is no need, there is no longing or need for PPEs, for cleaning supplies,
Right.
for constant reminders. I mean, I feel like a broken record every management meeting. I know managers are hounding. I'm, 100% compliance is necessary. Cleaning. I just can't emphasize to the people of Guam how serious this is. And as a director that is responsible for people in our units and in our homes, it's a very heavy responsibility. And I pray a lot. People who know me know I pray a lot, but I've never prayed more since March. And I've always said that we have to be very careful. I saw a CNN report wouldn't it be, it would be very different on Guam or in the world if everybody had if we had a marking, whether we are positive or not. I think people would be more careful. My concern is that because there's so much asymptomatic people going around, um, that people tend to not be as careful as they should be. And so I beg the people of Guam to not 100%, but 200% um, follow the protocols. Because if you and I were positive and we were in the same room and we were using our mask like the two of you are in the studio apart, even if the two of you were positive, you would not give it to anybody else or one of you because you're practicing those social distancing, the masking, and the washing the hands. So I think the washing of the hands may have gone away. I know they keep forcing, but it's the washing of the hands because if both of you, if one of you are positive, you would not get it, Sabrina, for example, if Chris was positive because you're apart, you're masking. But what if you don't wash your hands and you touch like the piece of paper that Chris might have passed to you and he accidentally had some germs on it? That's when you would get it. So all of it needs to happen, not at 100%, but 200% compliance.
Right.
And so the Guam Behavioral Health will monitor our staff, will monitor our home, we'll do everything we can, bring them to the hospital if they become symptomatic or anything changes or feels different. And then the key would be for everyone to isolate for 14 days and the virus will die altogether in the home, altogether. At that time, the home will have to be deemed all clear. We would come in with a professional, we have hired professional disinfecting companies to clean our satellite offices, clean our main facility, and then start from scratch, ground zero. So on day 15, 16, somewhere there, when we disinfect the house, then we would be on ground zero, everybody would restart. In other words, everybody will be clear and, you know, and life goes on.
Right.
But right now at this point, we just try to keep the house to be normal as possible. And thank goodness that everybody is asymptomatic. And as I mentioned before, other than being told they're positive and the anxiety that comes with that, nothing has changed in the home.
Therese, are you able to tell us what village the home is in?
In Tamuning.
The morning. Okay. Okay.
And just real quickly, Therese, you said
Sure.
the seven positive staff, they just work at that one home, right? They don't go
Correct.
to any. Okay.
Okay. Has this prompted any effort on your part to further test any of the other staff at GBHWC?
Yes, only because of the because of the asymptomatic. Just yesterday, I'm looking into, and I'm going to be coordinating with Dr. Kaneshiro for testing from one house to another. Because again, we're always telling our staff, and they're really good about it, don't come into work if you're feeling ill. But what if you're asymptomatic?
Right. That's the problem.
So the great number of asymptomatic employees is a great concern of mine and should be a concern for everybody on Guam. That just because somebody is not showing symptoms doesn't mean they're not a carrier of the virus. And so even more, we have to be concerned that the virus is a really silent virus that can penetrate our homes, our children, and our family members. And those we're responsible for. So the home, it's my responsibility. And it's very heavy. It's a heavy task.
What if something was to happen to one of the staff or one of the clients, Therese?
Then we all go through what is called debriefing. we all go through what we give the community, and that's the counseling support and the support. So right now, the Guam Behavioral Health staff knows that our services are open to them as well. You know, even just the whole anxiety thing.
Right.
Just because we work at Guam Behavioral Health doesn't mean that we are not like normal folks who don't feel the anxiety of the virus.
No, I know.
The only difference is like public health and GMH and other essential health agencies, we're working through it. So we've never stopped working since March.
Right. What about the parents?
So
The parents of these children that are in this group home, have they also been tested? What kind of?
well, these children are with us for various reasons, and they have
Okay.
not been, they've been with us more than 14 days.
Wow. Okay.
Okay.
Well, Therese, our thoughts and our prayers.
Just leave it at that.
Okay.
Right, definitely going out to
Yes.
the kids and the staff, and you know you and,
Yes.
and the
Thank
agency
you,
as
and
well.
I ask everyone to please be careful. Again, the number of asymptomatic people who are walking around with the virus is a very deceiving notion that they're well.
Right.
So that is why everybody is being asked, whether you feel well or not, to do the 100% protocols that is being asked of us. And with that, I just wish everybody well and can thank you for your prayers, and please continue to pray that all my staff and especially the clients that we're responsible of caring for on a daily basis, we continue to be asymptomatic and hopefully the virus will die after 14 days within the home and everybody will be clear. So again, everybody is doing well, and I can't ask for more than that, and I'm thankful to God for that.
Well, thank you,
Thanks,
Therese.
Therese.
Thanks for coming on.
Thank you very much. Everybody stay safe.
Okay,
Thank you.
wash
Stay
your
safe.
hands. I got to bring back wash your hands because you
Wash your
said
hands.
it went away. So wash your hands.
Yes, wash your hands needs to come back. I think everybody's got the mask down,
Right.
but the washing the hands.
Thank you.
Thank you very much,
You got it.
everybody.
Okay.
Have a
Take
good
care.
day.
You too, Therese. Esta. There you go, Therese Arriola, Guam Behavioral Health and Wellness Center. The takeaways, Bree?